Hi everyone. So next important topic is that arsenic metal. So arsenic metal, their sources, toxic effect, symptoms, biochemical effects, and then antidotes. So these concepts we are going to learn. Arsenic occurs in the earth crust about 2 ppm, in seawater 5 ppm, and in soils 1 to 40 ppm, and in human body and tissues 80 milligram, and in blood about 25 milligram of arsenic is present. The sources of arsenic are: arsenic commonly occurs in insecticides, fungicides, and herbicides, and among the compounds there arsenic plus 3 are the most toxic in nature. Arsenic toxic effects of arsenic. Arsenic is a general protoplasmic poison and it affects all the systems in the man. The order of toxicity of arsenic compounds are: arsines is more toxic compared to arsenite, then arsenate, then arsenic organic acid. Symptoms of arsenic poisoning are irritation, nausea, pain, vomiting, muscle weakness, liver damage, and skin disease. Next, we come to the important top concept is that biochemical effect. So that is coagulation of protein, complexation with an enzyme, uncoupling of phosphorylation. These three steps that mainly inhibits the generation of ATP. Arsenic 3 plus exerts its toxic function by attacking the thiol group of an enzyme, thereby inhibiting the enzymatic action. So in enzyme, these thiol groups are activating groups. These activating groups that is attacked by the arsenic compound, this leads to the inhibition, the process of the enzyme. The enzyme which generates cellular energy in the citric acid cycle are adversely affected. The inhibitory action is based on the inactivation of pyruvate dehydrogenase by complexation with arsenic 3 plus, where the generation of ATP is prevented. It is a arsenite compound, dihydrolipic acid protein. It attacks with this arsenate compound. It leads to the formation of inactivated protein complex with arsenic 3 plus. By the virtue of its chemical similarity to phosphorus, arsenic interferes with some of the biochemical process involving phosphorus. This is observed in biochemical generation of energy yielding the substance ATP. Arsenic 3 plus compounds at high concentration coagulate the proteins, possibly by attacking the sulfur bonds, maintaining the secondary and tertiary biochemical effects of arsenic under coagulation of protein, complexation with an enzyme, and uncoupling of the phosphorylation. Next, here glyceraldehyde 3-phosphate reacts with hydrogen phosphate. It gives dihydrogen glycerate. It reacts with ADP in the presence of kinase. It gives rise to the formation of ATP. So ATP formation takes place. So here the another reaction, this glyceraldehyde 3-phosphate reacts with hydrogen arsenate sulfate, this compound. It gives rise to 1-arseno 3-phosphoglycerate. On arsenolysis with water, it prevents the formation of ATP. So normal reaction takes place, this one, that is the formation of ATP. So hydrogen phosphorate reacts and ADP kinase gives the formation of ATP. But here, if the glyceraldehyde 3-phosphate is attacked with hydrogen arsenate as compound, it prevents the formation of ATP. This is how these three steps inhibits the generation of ATP, that is coagulation of protein, complexation with an enzyme, and uncoupling of phosphorylation. The general antidote for arsenic poisoning are chemicals having thiol groups capable of bonding to arsenic 3 plus, that is 2,3 dimercaptopropanol. It is known as British anti-lewisite. This antidote was developed by Britishers during the World War II, 1939 to 1945, for the protection against arsenical lewisite, hence the name British anti-lewisite. So this one is used as an antidote for the poisoning of arsenic.